everyone, welcome. My name is Dana Howarth. I am the Deputy Director of the New Mexico Caregivers Coalition. We're so thankful that you're all here on a Friday afternoon with us to learn some more information from two of our guest speakers. We're super excited. This is actually kind of a repeat. I did ask Samantha Morales to do this presentation again. So some of you may have seen it previously, but I hope you find it helpful if you are returning again. I just thought this was one of the best ones because it's an overview of lots of programming, and a lot of times people in New Mexico may not know what is available to them. So this is a great way to kind of get an idea of what that is. So before I pass it on to our guest speakers, for those of you that have already said hi in the chat, thank you. If you haven't said hi in the chat, or if your name is not showing on your screen, if you could please do so. It helps me with attendance to make sure I can check off who is here. I'll make sure everyone gets credit for being here. You will get a certificate for this, like we do with all our trainings. So we want to make sure that everyone gets marked as present. During the presentation, we ask that you keep yourself on mute. It helps kind of limit background noise on the recording. Sometimes the recording, the box on the recording jumps around based on noise, and it kind of, if it hears something, it will take its focus away from the presenters. So we try to avoid that by making sure everyone stays on mute. If you have questions during the session, please put them in the chat. The presenters will be doing a Q&A at the end of their presentation and then answering all the questions then. But we know sometimes you may forget them, so feel free to type them in the chat and then we'll scroll through later and read them. Okay, I think that's everything, all of my little housekeeping. So now to pass it on to our presenters, we're excited to welcome back Samantha Morales. She's the director of the Senior Medicare Patrol Program for the state of New Mexico. And this time she brought with her another guest. We also have Kelly Dickerson, who is the lead caseworker for the New Mexico Senior Medicare Patrol at the Aging and Long-Term Services Department. So thank you and welcome to you both. And we're so excited to have both of you here.
Wonderful. Thank you so much, Dana. Hello, everyone. And thank you for being here on a Friday afternoon. And we hope this training is going to be beneficial to you both. And so, Dana, I'm going to give you a moment to pull up the slides before we kind of jump in. And as Dana's doing that, yes, both Kelly and myself are part of the Senior Medicare Patrol team. We work at the Aging and Disability Resource Center, listed there. We're part of the state agency that you all know, most likely as the Aging and Long-Term Services Department. Wonderful. And if we can go on to the next slide, please. And it sounds like somebody may not be on mute there. All right, wonderful. Well, in today's training, we would like you to come away with a better understanding of how the ADRC programs can assist people in your communities. So the different free statewide programs that the public has access to through the ADRC. We're also going to provide an overview of how you can access our services through our state agency and resources via the ADRC. So kind of the ins and outs of how to communicate with the ADRC, who we are, what programs are housed within our state agency. And with that, I'm going to pass the baton over to Kelly for the next slide.
Okay, thank you, Sam. Can you hear me okay?
Yes.
Okay, wonderful. Okay, so all services that we provide are totally free and open to the public. The mission of the Aging and Disability Resource Center is to provide all New Mexicans with resources to maximize their personal choice and independence. We are the single point of entry to help with the overwhelming long-term services system. Next slide, please. We can help individuals in a variety of ways with other state agencies, including but not limited to the Human Services Department and the Department of Health, just to name a few. We can help with local agencies such as senior citizen centers, local areas agencies on aging, nursing homes, the Albuquerque Department of Senior Affairs, the Alzheimer's Association, and Cancer Services of New Mexico. We can also help with federal resources such as Social Security and the enrollment assistance on some federal programs such as the Low Income Subsidy Program, Medicare, Part D enrollment, and Medicaid. We can also provide referrals and assistance with thousands of community resources such as food pantries, Meals on Wheels, and other resources such as where to find durable medical providers, as just a few examples of how we can help. Next slide, please. The ADRC provides access to information, assistance, referrals, options counseling, and advocacy in those areas of daily living that maximize personal choice and independence for New Mexico's older adults. Staff offer options, coordinate New Mexico's aging and disability service systems, and provide objective information and assistance, and empower people to make informed decisions. Our role is to assist by informing and educating individuals and to empower them to make informed decisions that are right for them. Next slide, please. Sharing information with our community partners is a crucial part of our mission. We can provide additional presentations on other topics of interest to your community, such as the presentations listed on this slide, ranging from Medicare 101 to prescription drug assistance. Today, we're providing a brief overview of the assistance available. However, these presentations go into much greater detail. Next slide, please. Okay, we can provide phone numbers and referrals and provide guidance on how to access those services such as wellness programs and community services. We have over 1,500 social service programs in our network of care database, such as adult protective services, housing, legal services, and long-term care communities. We will discuss more about the network of care later in the presentation. We can help a client understand healthy and independent living. This could include informing them that Medicare Part B covers certain preventive services with no cost sharing, such as an annual wellness visit. However, please note, if the doctor makes a diagnosis during the visit or conducts additional tests or procedures, there could be costs for the visit. It is important to get to know the Medicare coverage guidelines. Next slide, please. The ADRC consumer assistance programs include all of these services. All are housed within the ADRC. We are providing you with information today on the services that the Aging and Long-Term Services Department can provide. Please call us if you need assistance or would like more information on any of these topics. And the ADRC phone number is 1-800-432-2080. And moving on to the next slide. Our phone number is listed here. And as I mentioned before, I'm going to sound like a broken record. It's 1-800-432-2080. And the ADRC serves all counties in New Mexico. Our resource center receives over 170 phone calls a day, handled by our dedicated staff, and we are open Monday through Friday from 8 a.m. to 5 p.m. There is web chat available as well, where you can chat online with an actual person that can answer your questions or make any necessary referrals. And we'll discuss more about web chat later in the presentation. And with that, I will hand it back to Samantha.
Thank you, Kelly. Okay, so in terms of options counseling. What is it, right? So when people first call the ADRC, they will speak with a staff member whose role it is to be an options counselor, OC, for short. So OCs are very important because they are trained to provide counseling on an array of Medicare, Medicaid, and other issues, including housing, for example. They will also screen consumers for state and federal programs that they may be eligible for and they may not know about. So OCs move callers to where they need to go, right, within our department. If a person has a Medicare issue, for example, they may send a referral to the SHIP program, the State Health Insurance Assistance Program that we're going to speak more about later in this presentation, or the Senior Medicare Patrol Program that we are representing here today, that we're also going to give more of an overview about as well. So in a nutshell, the options counseling, the OCs, are extremely important because they're going to be the first point of contact, your introduction to the state, the Aging and Long-Term Services Department, right? So again, in terms of their role, they do all of the things listed on this slide. It's about empowering individuals to make informed decisions about long-term care services, but also about so much more. And I'm going to be speaking more about, for example, the role of the ADRC with Medicaid programming. So, and that's going to be coming later, but it's very important that I wanted to kind of emphasize the importance of the OCs to help people navigate the Aging and Long-Term Services Department and the different programs within the department. And the other thing that I wanted to mention is the options counselors have access to translation services. So we have the capacity to speak to folks in multiple languages. And with that, let's move on to the next slide, please. Thank you. Wonderful. So what is short-term assistance, STA, right? So the STA assistance that we provide can encompass any number of issues, from health insurance related to housing to transportation. So as we note on this slide, STA services are available to anyone across the state who is in a crisis situation. So the goal of our STA services, our staff members who work with this team, is to help people stay independent and in their communities. So the last bullet point here gets to the assistance we provide when people transition from, for example, an institutional setting, like from a hospital, and they want to go back into their home in the community. So we even have staff members who can help people make sure they have all of the supports in place to help them get back home, right? So again, our phone number is listed on the slide, but it's the same 1-800 number you'll note to reach the ADRC, because all of these programs are housed within the ADRC. So for example, if you are caring for someone who's in some type of a short-term crisis and you need support, maybe it's a transportation issue, or maybe again it's kind of thinking through other types of issues that you may be dealing with that involves health insurance related. The short-term assistance program may be something that you want to ask for when you call the ADRC and speak with an options counselor, so that they can help you navigate and they can provide more information. And with that, I'm going to go on to the next slide. And Kelly already mentioned our our web chat services. Oops.
Sorry, I don't know why it started switching slides. I was trying to move a chat box out of the way. Which one was it supposed to be on?
Oh, no worries. It's slide number 12, I believe.
There.
Perfect. Thank you, Dana. Wonderful. And this is just a quick plugin that Kelly already provided. So it's just to inform everyone that if you are short on time and you're comfortable navigating the internet and you want to quick response to a question that involves our department, for example, it's a Medicare related question, or you would like to be referred to one of the programs that we're going to be discussing today, whether it's the STA program or one of the other programs like SHIP, SMP, etc., you can definitely send a chat. And to access chat, we're going to have the information at the end of the training, but our chat services are available Monday through Friday. I believe now the times have changed to 8 a.m. to 5 p.m. But the point is we have staff members who are well versed in all of the ADRC programming, and they can provide quick responses, they can take referrals, and so they can help you navigate next steps. So the chat is a good and easy way, efficient way of communicating with us in addition to our 1-800 number. So I just wanted to give that information there. And with that, let's move on to the next slide. Thank you, Dana. Wonderful. So this is the more complicated slide. So the ADRC is really important with the Medicaid home and community-based waiver. You can see the acronym there for short, because the ADRC, again, as we note in the slide, administers the central registry for this program. What does that mean? Well, that means that the options counselors at the ADRC are trained to help people who call who may be eligible for this program, who are interested in being screened for this program. The options counselors provide information, they screen, and they kind of walk people through the process. So I would like in this slide to kind of give you all a sense of what it looks like to kind of apply for the Medicaid and home and community-based waiver. And just so we're all on the same page, this program is really important for folks who are over the age of 65, for example, who are on Medicare and who may need long-term care assistance, right? The types of services that the Medicare program does not cover. So this is where this program becomes really important, because if the person needs like an institutional level of care, and they want to remain at home, they can apply to receive assistance, for example, through a home health aide or some other types of support where they can get, you know, some of these long-term care services that Medicare will not cover. If they are eligible for the Medicaid waiver, this program, again, they can receive those additional supports and services through the state Medicaid program. In order to do that, the first kind of step in getting to this program is calling the ADRC. So that's going to be really important because, again, what ends up happening is the options counselor will take important demographic information. They will conduct, oops, sounds like someone may not be muted there. There we go, thank you. So, so in terms of just kind of understanding the process, it takes about 30 to 40 minutes to, when you're speaking with an options counselor, to be screened, to address some of the questions that the options counselor is going to be asking. So it's important to have, for example, demographic information, the Medicare beneficiary social security number, for example, date of birth, etc. And the options counselor is also going to do an assessment for the activities of daily living. So there's a series of questions that they ask about the person's, you know, mobility and other healthcare related issues. So that's important to keep in mind. After that process with the OC is completed, there is a registration letter that is sent to the person's permanent address. So that's important to keep in mind. So it starts with the ADRC, our, you know, department. But it is important to keep in mind that the ADRC is only one piece of the process, right? The ADRC, for example, does not make a determination of eligibility about the Medicaid waiver program. That really is the medical assistance division through the Health Services Department that's going to make that determination. So it's the Medicaid office who's going to determine who is eligible for this program. So once if the person is eligible and is approved, it moves on to another party, right? That's going to be the Medicaid Managed Care Organization. Those are the Medicaid plans like Blue Cross Blue Shield, Western Sky, and then there's one more that I'm missing. So there's 3 of them where the person can choose one of those 3 plans for their Medicaid services. So the point here that I'm trying to explain is that the Medicaid waiver process, even beginning with the ADRC, is not a quick process. It can be very involved. It takes several months to even receive the packet, right? So it's important to make sure that the mailing address is accurate when you provide that information to the options counselor. So once it gets to the Medicaid Managed Care Organization that the person chooses, there's a care coordinator that is assigned depending on what plan Medicaid Managed Care Organization the person chooses. And then the care coordinator then is responsible for going out to make an assessment. So this is just to kind of explain that it is an involved process, but it is a very important program to help people cover the long-term care services that Medicare will not pay for. So, and again, the first starting point is through the ADRC with speaking with an options counselor at our 1-800 number that you're definitely going to have in our last slide, but it's 1-800-432-2080. And with that, Dana, I am going to ask to go on to the next slide, please. Thank you. So here we have more information about the State Health Insurance Assistance Program, the SHIP for short, which many of you I'm sure have heard about. So the SHIP is essential, right? We partner it's our sister program at the ADRC. When I say we, I mean SMP, that we will discuss more about in the next slide. But the SHIP is really, really important because the SHIP provides people with free and objective information on any number of Medicare related issues. So, so whether it's an appeal with Medicare, with the Medicare Advantage plan or the Medicare Part D plan, SHIP staff members, SHIP counselors are trained to help people navigate those complicated processes. So the SHIP program through the ADRC, we're federally funded to do this work statewide. So we educate the public about Medicare and we help people one-on-one. So again, if we receive a call through the ADRC where a person is dealing with, a Medicare related issue, it could be an appeal, it could be, the person wants to switch out of their Medicare Advantage plan or Part D plan because it doesn't work for them and they need to figure out a resulution. Again, the SHIP staff members and counselors can really provide assistance with guiding folks, helping them understand next steps. Now, also the SHIPs are really important with connecting people to programs benefits programs that they may not be aware of. And I'm talking about the Medicare savings programs, the MSPs that are administered through the local Medicaid offices that are important, right? Because if a person is on Medicare and they're limited income, they receive limited income monthly, maybe they just have their Social Security benefits, they may not know that they're eligible for a Medicare savings programs. Those are the programs that can help them save over $100 a month to save on the Part B premium. So the SHIPs can help people apply to those state-based programs. The other program that's essential for people on Medicare is the federal low-income subsidy program that Kelly spoke about. That's extra help is another way of knowing that program. That's the other name of the program. That's a federal program that helps people on Medicare subsidize and lower their prescription drug costs. So again, some people may not even know that they qualify for these programs to help them save money. And saving money means more money in their pocket where they can access, in other important necessities. So I encourage everyone to get in contact with us, with the SHIPs, right? Because with our SHIP program, and every state has a SHIP program. we again receive federal funds to do this work. So the other thing that I want to just make sure you all, take away from understanding what the SHIP program does in our state, every fall during October 15th through December 7th comes the fall open enrollment period. This is the window of opportunity that people on Medicare have to shop around, to make changes to their Medicare coverage, right? So that they can have the right kind of coverage for the next year, everything that covers their doctors and their prescription medications. Now, the SHIP counselors, SHIP staff members, those of us who are trained to provide Medicare beneficiaries with plan comparisons, we can help people navigate their choices. We can make sure that people know what's out there so that they can save money and so that they can make sure their medications are going to be covered and that their doctors are going to be covered for the following year. So again, the SHIPs offer tremendous support to our seniors, to our Medicare beneficiaries who are living with disabilities during the fall. So come fall open enrollment, please remember, especially if you're a caregiver to someone who is on Medicare, if you yourself is on Medicare, remember that the SHIP program provides that free counseling to help you do a plan comparison. So with that, and again, that last bullet point there on this slide is super important. I always like to remind folks, remember SHIP counselors, we are state employees. Some of us are, we have also wonderful SHIP counselors who are volunteers, experienced volunteers who are embedded in their communities across the state who have been doing this work for many years. But we are state employees or state volunteers. We do not sell any health insurance products. The information we give is objective and it's never endorsing one specific plan. So with that, Dana, let's move on to the Senior Medicare Patrol slide. Thank you so much. So here we have the Senior Medicare Patrol program that I'm sure you all have heard about, especially if you've been attending these trainings that I've been facilitating. So the Senior Medicare Patrol program is also federally funded. We provide services completely free across New Mexico. We help everyone who's on Medicare, their family members, their caregivers to navigate issues concerning Medicare billing, Medicare and Medicaid, because we have some people who have both programs. So when you have someone who is on Medicare and they have a billing issue that they don't understand, they don't really know why they're getting billed, they're concerned, that's where our program, the SMP program, can really provide assistance. You can call the ADRC, you can speak with an options counselor and let her know we would like to speak with the SMP program because we have a Medicare billing issue that we need help with. So it's a very important program. Now, part of what we do, we really want to educate New Mexicans, right? We want to educate the public about how to prevent, detect, and report healthcare fraud, especially concerning Medicare. So we want people to protect themselves. So a lot of our message has to do with how to protect Medicare beneficiaries from being victims of scams. So that's really important to our work. And we do this, we educate and inform the public Medicare beneficiaries through these types of presentations. We do this through, asking you to spread the word about what the SMP program does to make sure that people in your community are informed about, how to access these free programs. And again, we provide one-on-one assistance as well. So we do these types of trainings, but we can also, when people call and they need our help, we can have someone like Kelly follow up with the person individually over the phone to begin to ask, what the situation involves, and we can provide next steps and guide people. We can also help with reporting fraud. We've been working with clients, unfortunately, who have been victims where their Medicare numbers have been compromised, where they've given out their Medicare numbers over the phone to perfect strangers, who have just, mischaracterized who they're calling and said they were calling from Medicare, and they start asking for personal information. So we can really help people navigate what to do next. when they find themselves in that very serious situation. Because when a Medicare number is compromised, a lot of damage can happen. When scammers have Medicare numbers, they can falsely bill for claims that and services that the person never received. So it is an issue that is happening not just in our state, but across the country, where unfortunately our seniors are being targeted by so many scammers, right? So durable medical equipment scams, where people are sent, durable medical equipment to their home that they never even wanted, they never even needed, back braces, knee braces. So those are the types of issues that the Senior Medicare Patrol Program is funded to assist with. So I just want to make sure everybody is aware of the work that we do and that we are housed at the ADRC. So you can contact us by calling the ADRC. So with that, I'm going to pass the baton over to Kelly and we can move on to the next slide. Thank you.
Thank you, Samantha. If I could just add one thing to the SMP piece, I would just like to explain about the healthcare journals that we can provide. So what we do is we teach clients to record all of their healthcare appointments in a healthcare journal or a notebook, and then to compare it to their Medicare summary notices. And they should look for any charges for services or items that they did not request or receive, and to call us at the SMP if they find any. So please let Dana or Valerie know if you would like a healthcare journal, and we'd be happy to send them out to you. Okay, so on the next slide, we're going to discuss the New Mexico Prescription Drug Assistance Program. The PDA program was created to assist New Mexico residents struggling to afford their prescription drug costs. There's no age requirement to qualify, and anyone in New Mexico can call to see if there is any assistance available to them to help with their prescription drug costs. So again, call the ADRC at 800-432-2080. And with that, I'm going to pass it back to Samantha.
Okay, we have our first test your knowledge question here. So what I would like to do is just read the narrative and then pose the questions, and then we can go through the responses together in the next slide. So Mr. Sandoval informed you that he is experiencing issues with his Part B enrollment. So he received a notice from Social Security stating that the state of New Mexico is no longer paying his Part B monthly premium. So the notice also informed him that they will start deducting the Part B amount from his Social Security check. So he only receives $980 before deductions, and he's concerned about his rent. So he also received bills from his providers, his doctors, and he doesn't understand why. So he has never had to pay for services before. So the first question that we pose is, what programs can help Mr. Sandoval? And then the second question, what would you tell him? So with that, Dana, let's go on to the next slide with the responses. So here we have option letter A. So you refer Mr. Sandoval to 800 Medicare to find out more about what's happening. Option letter B, you inform Mr. Sandoval to contact Social Security Administration to find out what the notice means. Option letter C, you inform Mr. Sandoval to contact his providers to find out why they are billing him. And then option letter D, you refer Mr. Sandoval to the ADRC and you inform him to ask for assistance from both the SHIP and SMP programs. So with that, option letter E, the last option is both C and D apply. So I want to give everyone about a minute to kind of decide, and if you feel so inclined, I welcome you to just include it in the chat what your answer is. So with that, I'll give everyone 60 seconds to just review, and then we'll reconvene. And we're just about up with our minute. We don't have that wonderful music that Valerie usually plays when I do this for the case studies, but I love seeing the chat. So many of you participated, and yes, we are all on the same page. So option letter E is really the best choice here. So definitely option letter E, right? Because if we look at C, inform Mr. Sandoval to contact his providers to find out why they're billing him. If he's comfortable doing that and he's able to do that on his own, that's a really good first step, right? Because he can gather information. You can empower him by having him gather information from his doctor's office so that he can have that information. And then when he calls the ADRC to request assistance from SHIP and from SMP, he'll have more information to give our staff, right? And the reason why both SHIP and SMP apply here is there's multiple things happening to Mr. Sandoval that you all picked up on, right? So he lost a program, possibly the Medicare savings program that pays for the Part B premium. Something happened. He doesn't understand what happened, but all he knows from that notice from Social Security is they're going to start deducting over $100 a month for his Part B premium. He's never had to pay that amount because he's received assistance through the state of New Mexico with the Medicare savings program. So it is very important to connect him to the SHIP, because the SHIP staff members can screen him again, can ask him those questions, can even help him understand those notices, and can help him reapply if needed, right? What if there's an error, something happened, he didn't recertify? That's in the realm of SHIP. And now with the SMP program, you all recognize the billing issue, and that's associated with SMP. That's in the realm of SMP. So he's having providers billing him. And so we have to understand why that is. And that's where the SMP staff member can really provide him with assistance, right? We can do a little bit more digging. We can help him understand his options and next steps. So thank you so much for participating. Excellent. Excellent. I think everybody was on the same page. So this is good. And with that, I'm going to make sure to pass the baton over to Kelly. Oh, sorry, Kelly, is this me still?
Yes, I think it's you, Sam.
Sorry, I was ahead of myself. I was going on to the next case study. My
No
apologies.
worries.
Thank you. So not yet, Kelly, but so here, I know Kelly already mentioned this, but I wanted to give more detail about what the Network of Care Resource Directory is. It's basically self-explanatory. We at the ADRC, we house basically a catalog of hundreds of resources, both local, state, and federal resources that you can research and look through by going to that website that's listed there. Everything is vetted internally by the ADRC. So again, we have community partner information in there. We have nonprofit information. We also have, like, if folks are looking for specific programs within the state, you can do a keyword search and the information, the contact information of that organization should come up. So it's really user-friendly and it's vetted internally by our staff. So I wanted to make sure that everybody is aware that this program exists. It's essentially, I love the description on that fourth bullet point. It's an online library of information about health and human services. So an array of resources that are accessible to you completely free, right? So I welcome you to explore that resource. And with that, now, Kelly, it's the next slide is yours. Thank you.
Thank you, Samantha. Moving on to case study number 2. Miss York would like more information about how her mother, Alma, can receive long-term care assistance. Alma is on original Medicare with a separate Part D drug plan. As the surviving spouse of a veteran, Alma has access to VA benefits. She's been diagnosed with late-stage Alzheimer's. So what information would you provide Ms. York, and what programs are available to assist Alma and her caregiver with long-term care needs. So let's move on to the responses on the next slide. And we have option A, refer Ms. York to the ADRC and advise that she speak with an options counselor to discuss options and to register Alma for the home and community-based waiver. B, refer Ms. York to the Alzheimer's Association to find out about other resources that can provide support. C, refer Ms. York to the VA aid and attendance program. D, Ms. York should call 1-800-Medicare to find out about how and when Medicare covers home health care services. And finally, option E, all of the above. So I'm going to give you about 60 seconds to chat in your responses. Okay, the time is just about up and you guys are awesome. I'm seeing lots of E's. And yes, the answer is E. So Miss York should definitely register for the waiver. And the Alzheimer's Association assists not only the Alzheimer's patient, but also the caregivers. And as the surviving spouse of a veteran, Alma should always access the VA benefits that are available to her. And lastly, it is always the best practice to contact Medicare directly to determine the Medicare coverage guidelines. And with that, I'm going to pass it back to Samantha.
Thank you, Kelly. Wonderful. So I always, in our trainings, as you all know, those of you who have been attending these trainings, I always love to plug in our volunteer program at the ADRC because really we would not be able to do the work that we do without our experience and our committed volunteers. And so we are always promoting the volunteer program because we do want to see it grow. Because again, we're a small program, we wouldn't be able to serve everyone across the state without the commitment of so many of our volunteers who are, again, embedded in their communities. So again, we provide support and training for all of the volunteer tasks. That includes, for example, administrative tasks, that includes doing presentations in their communities, that includes Medicare trainings. So all of the different activities that our volunteers are involved in. We even have volunteers who are assisting us with our newsletters and with the publication, with the editing, with the creation of our newsletters. So if you would like to hear more about our volunteer program, if you're interested in learning more, I welcome you to get in contact with us via the ADRC or let Dana know, and we would be more than happy to follow up with you directly. So with that, let's go on to the next slide, and that's going to be Kelly again.
Thank you, Samantha. And moving on to case study number 3. Ms. Huerta informs you that she is unable to afford her medically necessary prescription medication. She also tells you that she is struggling to pay for food and utilities. As a 50-year-old disabled person on a fixed income, she is uninsured and she is not sure how to get access to affordable insurance. What information would you provide? And let's move on to the responses on the next slide, and I'm going to pass it back to Samantha.
Thank you. All right, so this one's a bit different than the other two, right? So let's do option A. You refer Ms. Huerta to the ADRC and you let her know to ask for the PDA program. Option letter B, you refer Mrs. Huerta to her provider's office to see if they have medication samples. Option letter C, both A and D apply. What is option letter D, right? So that's refer Mrs. Huerta to the ADRC and let her know to ask for the STA, Short-Term Assistance Program. So with that, we're going to do the same thing. I'm going to give you 60 seconds to decide what the best option is for Mrs. Huerta. Feel free to enter your answers in the chat again. Thank you. Wonderful. And our minute is just about up and I see a lot of C's. So I love it. You all are speaking our language at the ADRC. You're all trained now. What is PDA? What is STA? What is SMP? What is SHIP? You all are able to identify in this case study that, again, option letter C, both A and D really are the best options. So if we look at option letter A, refer Mrs. Huerta to the ADRC and let her know to ask for the PDA program, right? The Prescription Drug Assistance Program. She's having an access to medication issue. You all basically have coded that correctly, right? That means PDA. You connected that issue with the PDA program and we can assist through the ADRC because PDA is housed within the ADRC. Now, option letter D, refer Mrs. Huerta to the ADRC and let her know to ask for the STA program. That also applies to her situation because she is having a short-term crisis situation, right? I mean, in the case study, we read that she's a disabled person on a fixed income. She's uninsured. She's struggling to pay for food and utilities. Now, the STA staff members, those team members can definitely help her with those issues. They can work with her to find a resolution with her, right? So you basically, again, it's about identifying and connecting our ADRC programs given the person's situation. So again, wonderful. We're all on the same page. You're speaking our language now. So with that, let's move on to the next slide. So we're pretty much at the end of our training here. And you can see this is our contact information. The 1-800 number is listed there. Again, to access chat, it's going to be that web link there. We also have a department email, and that's also available there. And of course, we have offices in these different areas throughout the state. The Santa Fe office, however, is the only office that is currently open to the public. So we are seeing people, in person. Albuquerque, Las Cruces, and Roswell, not yet, but that I'm sure will change as we get closer to, in the next couple of weeks. They will most likely open up to the public again. So let's move on to the next slide, which is about our survey. Just to plug in about our survey, your feedback is incredibly valuable to improving our program. We are very appreciative. I am very appreciative. It's an anonymous survey. If you have 3 to 5 minutes after this presentation, I welcome you to complete the survey and let us know your thoughts about how, answering just a few short questions about this presentation today, because it helps us tremendously. And with that, it's pretty much, we're at the end. So I open it up to questions. Let Kelly and I know what questions stand out to you about the ADRC programs, what we do. We're all ears. So this is an opportunity to kind of engage with us.
If you have a question, feel free to unmute and ask, or you can type it in the chat if you would feel more comfortable typing it in instead of saying it out loud. Either's an option. I will put the link to the survey in the chat so folks can take it, and to point out that this survey is separate from the survey that you may have completed for New Mexico Caregivers Coalition or with Valerie. This survey is specific to Samantha and her organization. Also, I will send out an email, a follow-up email that has the link in it and the slides for you, for folks to have.
Thank you so much, Dana.
Other questions?
Everybody's quiet on a Friday.
It's a Friday afternoon. If you come up with it, if there are no questions right now, but if you have a question later, you're welcome to email them to me.
So I have a question. Hey, Dana.
Okay, go ahead.
Yes, Elizabeth. I'm here. I came in a little late. Sorry, I forgot I was on. But I heard a lot. But my question is, I know this is for New Mexico, but as you remember, I live in New York. Can I also use these numbers to get that information, the 1-800 number at the bottom, if I needed help with this? Because as I'm 65 and I do have Medicare, I do not have Medicaid, and I do pay for my meds with the Part D supplement. Also, it's expensive. So it's, there's like, do I pay for my meds or do I buy food? So
Of course.
that number, the 1-800, would that assist me as well?
What I would say is, so you're in New York, welcome. I'm so happy you could join us. So it's wonderful to have you. What I would say is, so the ADRC is state specific to New Mexico. However, what I can say is we can connect you to your SHIP in New York. In fact, I used to live in New York. So I used to work with the SHIP in New York very closely. So you have an SMP program and you have a SHIP program in New York. Each state has these programs available. So I'm more than happy to provide you that information. So if you would like, I would say connect with Dana, and Dana can send me your contact information and we can chat offline, and I can send that to you via email, or I can provide you with that information. Because again, it's called HICAP, actually, the SHIP in New York. But I'm more than happy to provide you with their contact information so that you can make sure that you are screened for the Extra Help program, which is the federal program, to see if you might be eligible to lower your Part D prescription drugs, for example, and maybe even a Medicare savings program, right? You want to make sure that you're aware of what those income limits are, because you may be able to save money on your Medicare costs, and why not, right?
Yes, definitely. Thank you so much.
Of course.
To Dana, so that she can have it and forward me the information. So that would be helpful. That would be very helpful.
I will make sure to do that. I can even do that. I can send Dana the information for you, and you can connect in that way. Okay, thank you so much. And I'll put my email in the chat box. Oh, wonderful. And I will have it. That sounds great. Thank you. And that's an excellent, your question just prompted me to let everybody on this call know, because we were working closely with the New Mexico Caregivers Coalition. And so all of you who are part of the network, If you have an issue that you're kind of dealing with that's Medicare related, that's Medicaid related, that involves some of the things that we were discussing on this training, please connect with Dana so that she can connect you and you to me, right? Because I could be the bridge to the ADRC, right? So if you feel like, yeah, if you feel like if you're here in New Mexico and you're maybe have been unable to get through to the ADRC for whatever reason, or maybe you're not quite sure where to go, maybe you want to get in contact with the SHIP or with the SMP program or any one of our programs that we mentioned today, we can be that bridge. And so Dana, again, would connect us. So feel free to kind of send an email to Dana, let her know what the issue is, and then just giving her your permission to share your contact information with me. And I'm more than happy to follow up with you over the phone or via email.
Thank you so much.
Thank you. That's so gracious of you, Samantha, to be able to do that. But yes, I feel like that is a big help for folks. We kind of can be that bridge to the ADRC and Samantha at the SMP to connect folks that need or may have questions or need help. Are there any other questions about today's session? We have a quiet group today. Sometimes you guys are extra chatty. Today you're very quiet.
It is Friday afternoon after all, right?
Yes, it is a Friday afternoon.
You ladies are amazing. I've learned so much in the last 3 weeks with Medicare a few weeks ago, and then last week a lot of the information about Medicare, and now this week I can share this with so many seniors like me who just made 65 and we're like lost in the system. So thank you.
Thank you so much for your feedback, Elizabeth. Thank you everyone for attending today. I always appreciate the discussions with this group. It's one of my favorite groups to present in. So thank you all for your attention.
Yes, thank you. We're so glad you're finding it helpful, Elizabeth. That's one of our goals, is that we want to make sure we provide information to folks and provide information that may not have already had previously. One last call for questions. Any questions, any last minute thoughts, comments? Okay, well, if not, I will give you back some of your time and you get to leave a little bit early. So thank you so much, Samantha and Kelly, for joining us today. We appreciate you. And as usual, Samantha will be back next month with another Medicare training for you. So hopefully we'll see you in her next training.
Thank you. You have a good
Thank you,
weekend.
Dana.
Thank you. Bye, everyone. Have a great Friday and a great weekend.
Thank you.